Welcome everyone to Dental XP. Welcome to this webinar Wednesday. It's always a pleasure for me and Alessandro being here in this website. We want to thank, of course, all Team Atlanta for inviting us, and all Dental XP team like Tyler, Pana, for helping us in editing this lecture. So what we are going to speak today about is digital dentistry in the management of simple and complex cases, and more in details we are gonna show you all the characteristics of the digital intrascanner that we have been using in the last 2 years. In order to do that, we divided the presentation in 5 main parts. We're going to start about talking the differences between the traditional and the digital clinical workflows. Then we are going to get into the details of the ZFX intrascanner. We're going to speak about the characteristics of the system. We're going to show you our learning curve, our experience so far. So we're going to show you cases on natural teeth and single implant. We're going to speak about how could a digital future could be, and at the end I will try to give you some conclusion and some take-home messages. Before starting, I want to thank especially Eddie Salama for the organization of the first Dental XP Global Symposium. Alessandro and myself, we have been lucky enough to be part of it, and we are really looking forward to the second one that is going to be held in Miami next June. So let's start. As I was saying, let's see some differences between the traditional and the digital clinical workflow. The traditional step-by-step procedure, the one that we always used since the last 30-40 years, is that when we have, for example, this complex case in where you can see both implants, teeth, and periodontal abutments, and we arrive at the step of the final impression, we can take the regular traditional impression from which it will be poured a master model, and on the master model a prosthodontic project based on the second provisional is going to be done on wax from the technician, and from the prosthodontic project will come out the frameworks. The frameworks will come to our office. We will try them in. If everything is gonna look okay, we can have the bees bake. We try the bees bake in, and at the end of the treatment plan, we can deliver the final restoration to the patient. In the last 10 years, CAD/CAM technology changed a lot the life of our dental technician already. So this is not already like something that is going to be in the future, but this is already in the present. And let's see, for example, this other complex case in where even here you can see teeth, implants, periodontal abutment, and even here we start from the step of the final impression. After that, again, the prosthodontic project has been done. And from here, where the CAD/CAM technology helped our technician was in the possibility of scanning this prosthodontic project and working on the computer on different software, in where the technician can work on the final framework design, can put his knowledge inside the digital technology, and design the frameworks exactly as he likes. Once that he is okay with the framework design, he send the file to the milling center, and the milling center will send us back the frameworks. We will try the frameworks in. We will go to the bees bake phase. If everything fits okay, and if everything looks good for us and for the technician, we can deliver the final restoration to our patient. So as I said, this is already like the present. It's not something that is going to be the future. This is really the present. What is really the challenge for the future is that all the dentistry today would like to close this circle. We would like to have a full digital circle from the beginning, from when the patient walks in our office till when we deliver the final restoration. And ZFX and Zimmer are working together hand by hand, and we think that the future is and the closing of this circle is not so far in the future. Of course, we will see today, we will speak about the intra scanner that you can see here on the right side. As you can see, it's like a computer and an end piece, so it's really easy to carry also between the offices, especially if, for example, like us, we have like 2 clinics and we have to carry the digital intra scanner in between the 2 clinics. And we will see today how the step-by-step procedure with the CAD technology can also change our workflow, can also change our clinical lives. So the clinician can, for example, in a case like this, it's a simple case in maximum intercuspation, arriving at the day of the final impression, and thanks to the intraoral scanner, we can scan the patient's mouth, and from here we can send the files to the lab. The lab will work on the CAD part, will work on the framework design with very predictable softwares, and you will see during this lecture how we can solve these kind of cases. So before going into clinical materials, let's go to have an overview of all the characteristics of the ZFX intrascanner. The confocal microscopy is the technology that is behind the system. This scanner permits us to acquire three-dimensional digital data from inside the mouth, and it can also read soft tissue morphology directly, thanks to a series of single overlapping photoshoots which are linked together in real time, and we are going to see it exactly how we can do that. Those are the main characteristics of the system. And for example, what we think that are the most important one are the fact that it is an open system to all the major dental CAD on the market. It has a smart pixel sensor for a quicker and more precise scan. It is possible to scan the soft tissue without the need for additional powder, and we will see that when we place the powder is only to increase the fast in order to make a faster digital impression. The weight, as I was saying before, is only 600 grams, and it's really like easy to carry between different offices. For example, the scan field on the object is exactly like the dimension of one single abutment. And another thing that is important is that all the files that are coming out are STL files. And in our opinion, probably the most important characteristic of the ZFX system is that it has the copyright for the real-time stitching. That means that it overlaps all the single Photoshop one on top of the others in order to show us a sort of video in our computer screen. And we're going to see it later on how it is exactly. As I was saying before, the smart pixel sensor works exactly like this. You see those are 6 different photo shoots, and it matches it together in order to give us like the 3D model generated on the right side. It's a system that is very easy to understand because, as you can see here, there are different colors, and you have the 3D model generated in the middle, and of course there are gray points that are the points that are already acquired in the model. On the top right you can see like a green area that is exactly what the scanner is currently viewing. You can see, for example, also some orange points, and we're gonna see it after during some videos that I will show to you, that are basically the points that are just added to the model. We have, of course, some black holes that are the points that are still not acquired in our scannerization, and we have this big green area in the middle of the 3D model generated that are basically are the points that are already acquired in the model and actually are in the frame of the scanner. At the end of this green area you can see like a blue frame, and this blue frame are basically the points that are already acquired in the model and are not currently in the frame of the scanner. Sometimes you can have also in our computer screen, we can have also this kind of picture, this kind of situation, where in the top right we have, instead of having a green area, we have a red area. This is the system that is telling you that you lost the signal, that the photo shoots are not overlapping together in a good way, and basically your scan has stopped. And until that the picture on the right is gonna be red, it means that the scanner is currently viewing that kind of picture, but the two photo shoots are not overlapping. So the photo shoot of the blue frame that you can see here in the 3D model generated, that is the last photo shoot acquired before the scanner lost the photo shoot overlapping, has to be exactly the same of the one on the top right. And when the two photo shoot will overlap again, the scan will start. At the end of the scan, for example, you can also do a cutting of unuseful part in order to have a lighter files. In order, since you can send in real time the files to your technician and to the milling center already, they can also see it. You want to have some light files, and so you can cut the unuseful parts, some less important areas that you really do not need. You can post-process immediately the file. And in our opinion, what is really an advantage of this system is that it gives you the possibility for the clinician to set the margin prior to sending the files to the technician. And we're going to see it again in a video how this two-dimensional depth position guide helps us in exactly determine the finishing line that the clinician wants. We have also the possibility to check the shape and the conicity of the preparation in real time, and because we want to have like a determined at least 1 millimeter, for example, occlusal length, in order to avoid the voids and in order to be more predictable and to decrease the risk of fracture. One of the really important characteristics of the system is that it is an exclusive online platform that gives you the possibility to control and secure the data exchange during all the treatment process between the clinician, the lab technician, and the milling center. It is also a no-click fee system, and this is something that is important to underline because most of the intrascanner now on the market are click fee systems. There is also the possibility to have a ZFX milling house that gives you the possibility to mill soft materials like resin, composite, and zirconia directly in your dental office or in the technician's laboratory. But as I was saying before, let's see our ZFX experience so far. What you are going to see today are all cases that we both treated traditionally and digitally, because we wanted to see how the digital technology is working and where exactly gives you benefits and where exactly gives to the clinician some limitation. So you are going to see cases on natural dentition, cases on single implants, and also what is that the digital technology and the new intrascanner is where is helping us in restoring complex cases. Before starting our cases overview, I just want to cite one of the few articles that is present in the literature from Dr. Gallucci, in where he was comparing the digital versus the conventional implant impressions. And the aim of his study was to evaluate the efficiency, the difficulty, and the operator's preferences of a digital impression compared with a conventional impression for single implant restoration. And the nice thing of this article was that it chose as a clinical operator some students from the second year of the dental school, so that they did not have either a traditional or a digital background. And the results that he presented were that the students preferred to use the digital system for the 60%, and that also their perception on effectiveness and proficiency was higher in the digital system towards the conventional impression. So this is why also we did like all the cases that we are going to present to you today, both in a traditional way and in a digital way. So let's start with the natural dentition cases. This is Claudio, who was exactly the first ZFX patient that we treated. As you can see, it's like he walked in our office in September 2011 with several aesthetic issues. The gingival zenith were okay, but he had like some discoloration, for example, between 8 and 9. He didn't really like his two central incisor and especially the diastema in between. So he was asking me and Alessandro to improve them with better shape and shade, and if there was the possibility to close the space. Of course, as every patient, we follow a protocol and we take all the pictures of the patient from the macro aesthetic, so the facial analysis, to the micro aesthetic, so the intraoral pictures, and of course we collect other information, for example, as you can see here, a periapical x-rays. He had like this tooth that treated after a trauma 12 years ago, 12 years before, and of course the tooth was asymptomatic and there was no lesion, so we decided not to retreat. And here you can see that we want to test the system with the different finishing line, horizontal on number 8 and vertical on number 9. And before starting prepping the teeth, we perform like a whitening in tooth number 9, that was this chromic. And as you can see here again, the preparation has to be really smooth, rounded, there should not be sharp edges. And when we have been ready to take the final impression, we just spray a very little powder, as I was saying before, and here you can see already some of the advantages that I was telling you before. For example, the possibility of checking and doing our own ditching. This is the final restoration, to lithium disilicate restoration. As I was saying, a veneers on number 8 and a full crown on number 9. Done in a very good way from one of our dental technician, Laura Morselli. You can see the X-ray, you can see the precision of the crowns, and our perception was positive for this first case. And you can see from this before and after that we managed to close the diastema, and we managed to solve all the aesthetic issues that when Claudio walked in our office asked us to retreat. And you can see here from another case is a periodontal case, a teeth that we treated, and we were ready to take the final impression. And of course we did it both traditionally and digitally. In our digital impression you can see another advantage of this technology. In this teeth that was treated with an osteoaesthetic surgery and then was prep it, and of course there was a temporary, and was in the posterior region. We take this digital impression and we saw that there was an undercut, and this is a very big important thing that I'm telling you right now, because in real time you can see when the patient is still sitting in your chair that you see something that is not working in your final impression, and the only thing that you have to do is take the bore, reprep the teeth, and retake another impression, and you can check it before and after, and you can see now that the undercut is gone. Of course, it's a posterior area, but thanks to the mirror in front of the handpiece, the laser beam is angled at 45 degrees, so even if we are in a very posterior area, we can still taking a digital impression. So here you can see the technician digital workflow. You can see how Luca Dondi in this case is working in the CAD part and is designing the framework by using the zirconia as a dentinal layer and giving support in areas that he thinks that are weak, and in order to increase the strength of our final restoration, in order to give a longer term stability of our final restoration. And here you can see the final crown digitally and clinically, left side and right side. Of course you can see the particular shape of this crown, and you can see it here again, one overlap on top of the other, the digital part and the clinical restoration from an occlusal view, and also from this clinical view, you can exactly see how we manage also to work on the shape of this crown and giving the space to the patient to clean that area. Don't forget that that was an area that was treated due to a periodontal disease. So the maintenance to have a longer term stability from the patient is really important. And by concluding this case, you can see this is what Luca thought that was appropriate for a framework design. We tried it in the mouth, and you can see that it really reflects exactly what Luca was thinking, and at the end, the final crown in place. Let's talk about some vertical finishing line. How does the system works on natural dentition with vertical finishing lines? And let's see, for example, this case. This is Nicola, 32 years old. He was a patient. He entered in our office in 2011, even him with some aesthetic issues. You can see like this 7 and 8 restoration, PFM restoration with several aesthetic issues. For example, the midline was canted. He was complaining about the gray of the final PFM restoration. He was complaining about these gingival symmetries that were not exactly the same as on the contralateral side. And of course, this was a tough patient because we are discussing with a patient with a nice myline. Again, we collect all the information that we needed, the pictures, the periapical X-rays, and as the patient before, as the previous case that you saw before, this patient had a trauma 10 years before, and he had these two teeth treated, and he had these two final restoration done. And even in this case, the teeth were asymptomatic, there was no lesion, so we decided not to retreat these two teeth. And of course, you can see from this particular view how we decided to treat this patient. We decided to prep the teeth with a vertical finishing line in order to conserve and to be more conservative with the natural tooth structure, and it also to bring a little bit more inside the preparation to give more space to the technician to build and to give like the correct thickness for the final restoration. Of course, we removed some undercuts in the sulcus that are clearly in the sulcus that are clearly evident in the picture in the middle. This permit us the choice of the vertical finishing line permitted us also to be able to treat prosthetically the gingival symmetries, because what we did was just while we were relining the temp, we could have had the possibility to add some flow, as you can see here in the arrow on the left picture, and then placing the temp again in the mouth of the patient. You can see the ischemic tissue, and after like 1 minute you can see that the tissue is adapted to the new shape of the provisional, and you can see that there is no more ischemy. And you can see that thanks to this step of the treatment plan, we managed to correct the gingival symmetry, and the gingival zenith are now exactly the same in the two-center incisor. As in all the cases that we have been treating in the last 2 years, we did also the traditional impression, and you can see that the protocol is not changing. When we arrive at the day of the final impression, the tissue has to be healthy. We have to, of course, to use the cords in order to push horizontally and apically the soft tissue in order to give the possibility to the paste, in this case, of the final impression to get inside the sulcus and read the finishing line. Same thing for the digital part. You can see here in this picture very little powder, as I was saying, only to give the possibility to the scanner to be a little bit faster. And here is the final restoration in place after 3 months. You can see starting from time 0, after 1 month when we deliver the provisional, and then from the provisional we went to the final restoration, and we managed to also solve the problem of the canting midline just by doing a small osteotomy on tooth number 9. Osteoplasty, sorry. And here you can see Again, the final restoration in place, where two full zirconia crowns on number 7 and 8. 12 and 11 is of course the European classification of the teeth. You can see the X-ray, so you can see the fit of the crowns. You can see the great work of Luca and Matteo Dondi, and you can see of course the face of the patient, that is always important to evaluate, to see how the smile blends in with all the face of the patient. And let's see, for example, this other patient, a female, 53 years old. She walked in the office in 2012, so we were having a little bit more experience on the software. She, of course, had some aesthetic issue as well on tooth number 8, 9, and 10 that were done like 10 years before. And you can see that the differently from the other two cases that I just showed you. In this case, also the root canal needed to be redone, so we needed also to retreat the teeth. And of course, as every case we have in the office, we start collecting all the information, taking the pictures of the face, taking the picture of the dentolabial analysis in order to evaluate the smile line, and of course also the intraoral analysis, in where we can see that we have like some aesthetic issues, not only due by the white aesthetic but also from the pink aesthetic, where the thick biotype and the gingival zenith needed to be a little bit modified. Of course, nowadays we have like something very interesting. This is the digital smile design from Christian Kochman, that is another dental expert of the website, that basically permits us to diagnose the patient digitally, to show the patient how the final restoration can be, and is a very important tool also for us in order to evaluate the patient, evaluate the dental proportion, evaluate the axis of the teeth, evaluate the embrasure, the midlines, and so is a very important tool that gives us a lot of important information. And of course, the first thing that has to be done is to take out these crowns and reprep the teeth in order to eliminate again all the undercuts, change the finishing line, passing from an horizontal finishing line to a vertical finishing line, because we want to be more conservative and we want to preserve as much as dental structure as possible. Then we place the temp. Rita Agnoli, Dottoressa Rita Agnoli, that she is one of our co-worker, does the retreatment, and then we can rebuild with an aesthetic material, with a white material, because we chose to use a metal-free restoration, and of course we have to rebuild the teeth with white material. We can now place again our temporary, and of course you see here ischemic tissue, and you see that we are doing exactly the same as the previous case. We are prosthetically managing the soft tissues. So again, we arrive now at the day of the final impression. Again, we take traditional impression, digital impression, and right now I want to focus your attention on the digital impression. You see that in this picture we already placed two cords, and you're going to see in details in the video that I'm going to show you in 2 minutes why and how we place the cords. But before, we have to know that we have to follow some protocol, especially when there is something new in our protocols, in our procedures. We have always to follow a protocol. And first of all, we have to know digitally that there are some important areas in where holes in the scan will influence the final quality. So before even starting to touch the patient in the appointment of the digital impression day, we have to know that we have to take the surface and the margin of the preparation. We have to scan correctly the contact points of the restoration, and also the occlusal morphology, the area of the final restoration, but also of the opposing dentition. And besides the important areas, we have also some less important areas in where holes in the scan will not influence the final quality. And for example, are the cervical areas distant from the preparation, or the interproximal areas distant from the target area. And before starting our scan, before taking our intraoral scanner in our hand, we have to have a defined protocol in our mind, and we think that this three-step protocol is the most appropriate right now to digitally scan a patient. So the first step is to define the target area. So before starting, you have to define in your mind the limits of the important area around your preparation and your implant. And of course, you have to speak with your lab technician, and you have to ask also to him which are the important areas that he wants to have in the scan. The second part the second step is to do an overall scan, in where you don't have to worry about holes that you can fill them up later, and you have to continue the scan until the end of the target area, because on step 3 you're gonna check and finish your scanning. And of course you can always, like, by twisting and rolling the files, you can check if there are any black holes in the important areas, and if you're not happy with the scan that you did, you can just press the back button on the scanner and you can start again. So let's see this video where we have, like, literally all the digital workflow of the digital impression day. So this what I'm doing now is just doing the prescription for the lab. The only difference before with the traditional procedure is that I'm doing it on the computer and not on a paper. Then I save it, and then I start beginning to choose all my parameters. I choose number 8, and I want an anatomic cupping in this case, so I click on it, I choose the material that I want, and I choose also the shade, for example. I can choose also which kind of scan I can do, and then I can move on. And it's very easy, it's very less time consuming, because I can do copy and paste. By clicking those blue area, I can choose not to have connectors in between the 3 crowns. And of course, as I was saying, important areas, so I have to define an areas, and I have to click also on the adjacent teeth of my restoration. And you see, click and paste, and then I can save it. Same thing for the opposing dentition, it's really easy. I can choose an antagonist from here, I can save it, and then by copy and pasting I can finish my prescription to the lab. It's very important also to go on and choose the jaw registration, of course, and then you can save it and you can start the scan. If it's the first patient of the day, the system asks you to calibrate the intrascanner, and it takes really 10 seconds by just placing the scanner in that place. And you can see on the left side the wizard that is always with you during the scanner and is helping you every step you are doing. So you see here we have the provisional in place. So what we are doing is just to take some powder and just spray on our provisional, and you can see here very little powder is needed, not as much. We can take now the scanner in our hand, and we can press go, and we can start scanning. And you can see here clinically the slowly movements, because of course even especially in this moment we have to be very precise, and we don't have to rush. Very slowly move, and you can see here what we are seeing in the computer screen, and you can see all the different colors, all the different colors that I was talking about before. You can see here the 3D model generated in the middle of the screen, and on the top we have the green area that is telling us that we are doing good. Once we are happy with it, we can look at the model, and we can cut the unuseful part, because we can make the file lighter. We don't need those, so we can cut it. And if we made a mistake on cutting it, we can come back and do it again. So it's very easy, and then we can post-process it immediately. So this is what I was saying by having healthy soft tissue. So by spending time in shaping, smoothing, polishing, and planning your provisional, because this is what you want to see at the end, at the day of the final impression. You don't want to have any bleedings while you're placing the cords. you want to have like this kind of pink tissues while you're placing the cord. If not, you may lose some details and you cannot be that precise. You see, you have to be very careful in packing the cords, and from this picture you can see also how the teeth have been prepared. You can see that they are very smooth, the abutments, rounded, no sharp edges, polished. This is exactly how how we want the teeth abutment to be at the day of the final restoration, at the final impression day. Here we are packing the second cord. Of course, the two cords are helping us in pushing horizontally and apically the soft tissue, in order to give the space to the scanner to enter with his laser and read for us the subgingival area, the sulcus area, because it's where we are gonna place our margin. And you can see here we are packing the second cord, and you're gonna see that we are gonna leave these cords in place while we are gonna go and scan also the opposing dentition, because we want to leave this cord as much as we can in order to give them time to do what they are there, what are their goals. You see, very carefully packed all the three cords. You're gonna see an occlusal view now, where you're gonna see the tissue that is not bleeding at all. And once we have this, we can move on and we can put some powder on the opposing dentition and start to take also this scannerization. So you can see again, this is the ortho retractor that we are using, and the assistant is helping us with his left hand. As you can see, the movement again are very slowly, and you can see again all the colors that I was talking to you before. The green area on the top right, that is telling you that you are doing good, so the photo shoots are overlapping correctly. You can cut the unuseful data and you can post-process immediately. Okay, now I'm gonna present you one of the biggest advantage of the digital technology, of the digital intraoral scanner. We can take the scan of one abutment at the time, so we can leave the cords in place much longer towards like a traditional impression. And you can see here clinically and on the computer screen how the scannerization is evolving. Okay, you can see here also the scan has like 2 centimeters as working distance. Once we are done with the first abutment, we can take out the second cord, placing again very little powder and starting our second abutment scan. And you see the software is overlapping it together with the first scannerization in real time, and we have the 3D model that is generating. You can see some black holes that are gonna become gray right now. The movement are very slowly. Clinically, you have to be patient, and when you're happy with it, you can take out the second cord, the last cord, sorry, the second cord of number 10, and again start scannerization. Once you want to check it, you can roll the file, and you can see that there are some black holes that you don't like, so you can just by click on the point that you don't like, you can start again your scannerization from exactly that point, so you're sure that you're not gonna lose that area, and the black holes will become gray. Again, slowly movements, as you can see. All the areas that we think that are important now are taken, and now we move forward and taking the bite registration of the patient. That this is very important, this is critical to be taken, because it will help us and it will permit us and the technician to put together all the scannerization and start working on the finalization of the case. So you see powder in the patient's mouth, you see the ortho retractor that we are using. Always put some cream in the lips of the patient for his comfort. And again, you can see here all the black holes that are becoming gray little by little, the 3D model that is generating little by little, the green area that is exactly what you are scanning right now, and inside the green area sometimes you can see some orange points that are just being added to the model. So as I was saying before, as I was telling you, now you can just by overlapping these 2 points, you can overlap and you can overlap all your scan, and you can see, for example, here the abutments and the temp and the byte, sorry, in this case, and here you have the abutments and the temp that are overlapped, and you can see how precise we can be, and you can see how is helpful the wizard on the left side. And now, as I was telling to you before, one of the biggest advantage of this digital technology, the opportunity for the clinician to do chairside his own teaching, and to do his own teaching in a more predictable way, because here you can zoom in as much as you want exactly inside the canyon of your preparation. You see here, and just by using the 2-depth dimensional guy, you can just take these points and you can put the vertical, you can put the margin exactly where you want, exactly where you think is more appropriate, and you can do it together with your dental technician in 2 different computers in 2 different places, because as I was saying to you, thanks to the iCloud platform, everyone has the possibility to check at any time the files and has the possibility to see exactly what you're doing. Again, the wizard that is helping you here, that we are finishing up with the positioning of our margin. Okay, again from an occlusal view, and here this is the CAD evolution. This is our technician that is start working. This is Matteo Dondi, that is Lucas' son, that right now is just matching our temporary to the software library provisionals, and you can see that is smoothing it up, is placing them in the correct position, in the position that he thinks more appropriate, and then just by clicking this button the software start matching our provisional with the provisional of the library. And here is Matteo starts work on his final frameworks. You can see he has everything under control, the thickness of the final restoration, the thickness of the abutment, and now he can decrease the thickness and start working on the final frameworks. And here it's really important what is he doing, because he's putting his traditional knowledge, his knowledge of the new materials inside the digital technology. And you can see this particular shape that is giving to the frameworks, and we will discuss this later on, in order to give more strength. And exactly as you saw in the molar case before, is giving strength to this final restoration just by using the zirconia as a dentina layer. You see, when he's happy with his work, he can check his work in different angulation with the final restoration in place. You see different views, occlusal view, palatal views, and when he's happy with it, he can send the file to the milling center. And this is exactly what you just seen in the video. Are exactly the frameworks on the model, and you can see how important is to work with the highest quality possible of zirconia, because you can see how translucent is this zirconia, especially in this picture, especially on tooth number 8 on the top right, you can see exactly how you can see the abutment, the stone abutment that is visible under the framework. And you can see, as I was saying before, this is exactly what he planned 2 minutes ago in the software. Then of course we try them in, in the patient's mouth. We went already with the lateral tooth number 10. We went already to the beesbake because we wanted to check the shape and we wanted to start checking the shade as well. We put some black silicone paste, and again you can see how translucent is the material because you can see that you can see the black in the picture, and you can see how also precise are these frameworks. Now we have available some digital casts that are delivered to your office in 7 working days. They are working on several different materials. These were the cast for this particular case, and right now we have some other materials for the cast that are laser sinterized nylon. This is another case made by our dental clinician from our team, Ivo Siginolfi. And you can see here the final restoration in place in the model. I just want to show you these 3 pictures because I want to underline, I want to highlight again how important is to work with a good quality zirconia, in this case a Tozo zirconia, and you can see under different light how translucent is this zirconia. You can see in this kind of light, you can see in the blue lights, and here you can see the final restoration in place. Again, another great work from Luca Dondi. You can see the final restoration in place, you can see the smile of the patient, you can see the periapicals in where you can see the fit of the crowns, and you can see that they're very precise, and you can also see the great retreatment that Rita Agnoli did in this case. And of course, all these cases, I'm speaking a lot right now about digital and about digital dentistry, but it's important to have a team in your office in order to treat like 360 degrees your patient. And of course the digital technology is a great tool that helps you and helps the clinician in order to be more predictable and in order to have a longer term stability. And so you see a before and after of these 3 full zirconia crowns, 8, 9 and 10, in where we managed to restore and to recreate a nice aesthetic to the patient and correct also not only the white aesthetic with the teeth but also the pink aesthetic. And here you can see that for the same case we did another set of crown in lithium disilicate, because this case is inside a study that we are doing together with Dr. Steve Chu from Columbia University, New York, and Dr. Christian Stappert from University of Maryland, in where we are evaluating and describing the ceramic layering in zirconia oxide structures. Because what we think is that if you work with an high quality zirconia and if you have a correct protocol step by step for layer the ceramic into the zirconia core, you can obtain the same aesthetic result of a more aesthetic, compared to a more aesthetic materials, like for example in this case lithium disilicate. The result of this article are based also on the perception of the patient that is evaluated through online survey and also through a spectrophotometer analysis that has been done especially in the white and pink interfaces, both of the zirconia crowns and the lithium disilicate crowns. This concept comes from another article that Luca Dondi published back in 2010. That was a case report of this patient that entered our clinic in 2009 with these 2 metal ceramic restoration on 8 and 9. And you can see that here also PFM sometimes chips, especially in the incisal margin. And this case was treated, the restoration was taken out, the preparation were smooth and rounded a little bit, and look at the idea of doing 3 sets of crown, because he wanted to compare the aesthetic characteristic of zirconia, of lithium disilicate and feldspathic ceramic. Of course, these three materials are very different because zirconia it is known for having better strength characteristic than lithium disilicate and feldspathic ceramic that are known as better aesthetic materials. And of course, in the incisal margin, Luca was not expecting any differences between the three materials because he said that any good dental technician could have achieved the same result between the three materials. But what he was interested in notice and in let us notice that in the white and pink interface there was no differences. There was no differences between the three materials, and also that the perception of the patient, that by the way was another dental technician, was to choose the zirconia pair of crown. So from all this clinical observation comes out the zirconia inside laminate concept. That is a concept that Matteo and Luca Dondi have invented, and where they want to underline first of all how the framework design is changed between the years together with the clinical knowledge and on the digital dentistry. It's very clear here how in 2006, 2007 and 2008 the design of the framework were really linear, and now in 2013 you can see this particular design that tends to use the zirconia as a dentinal layer in order to increase the strength of the so-called weak areas. And as I was saying before, is important, and is it possible? It is possible to combine the static characteristic of a good quality zirconia together with its strength characteristics in order to solve cases like, for example, this case that was a patient with multiple periodontal issues that we have been able to retreat with a full zirconia restoration. And here you can appreciate the before and after and the great work of one of our dental technician, Laura Morselli. So here, to finish the first part of this webinar, the second part is gonna be we are gonna speak about our ZFX experience on single implants restoration, and also how could the digital, and how is the digital already changing our life and our treatment plans and our clinical workflows, also in complex case restoration and in full arch implant rehabilitation. So thank you for your attention today, and we'll see you soon in Dental XP.